the ANC party leader Musalia Mudavadi. For that conversation, I promised. Thank you for joining us here on KTN Prime. Perhaps just picking up from the kind of numbers we have been witnessing, November is being described as the darkest month yet. Perhaps looking at this second wave, experts seem to feel like we have lost, we have dropped the ball as far as our strategy is concerned. What are your thoughts? Do you think we're on the right track in the fight against COVID?
Well, thank you for allowing me to be on your show this evening. I would just want to say that the situation is indeed very grim, because if you look at a sample of about 950 and the tested people are 5,000, that is about an infection rate of 20%. So clearly that indicates that the situation is very dangerous because experts indicate that the infection rate, if we want to know whether we are making progress, should be way below 10%. So the first message that comes out is that the situation is grim and we need to take this matter seriously and take serious action with the necessary resolve so that we can curb the spread of this. I think one of the biggest challenges now is that it is no longer confined to a few urban areas. This was maybe the situation in the first wave, but with the second wave, we are now witnessing rapid expansion of the COVID virus in the rural areas where infrastructure is limited, in terms of hospitals and facilities, in terms of doctors. So we have a crisis on our hands.
Doctors are threatening to go on strike, and they've raised a number of issues. Key among them, the working conditions that they're working under, and saying that it is suicidal to continue working in hospitals without the necessary gear and the necessary support from the government. Does this worry you? How do we get out of this?
Yes, it worries me, and indeed they have a point. Because Akisa, let's just look at the statistics around the medical staff. We have an infection of about 2,500 medical staff who have been infected. Doctors have died. Even this afternoon, I was at the mass for Dr. Akisa, who used to be in charge of Nairobi County. He passed away, and I went to condole with the family. And what comes out clearly is that the doctors have legitimate concerns. One, they are on the front line, they are not insured, they have families that have to be taken care of. Apart from that, they have indicated that they do not have sufficient protective gear. And they've been talking about this for quite some time. That even if we get reports that there is sufficient gear, but how come the people who are supposed to say that we are satisfied, we have sufficient gear with us, are the ones complaining day in, day out? So one of the things that emerges out of this is, like, those of us who have some background in history, you will recall there used to be the Majimaji rebellion in Tanzania when they were fighting for independence. The traditional medicine men would sprinkle water on these guys and tell them that if you go to the front line, the bullets will not penetrate your skin. Now, we are in a kind of situation where our doctors have a situation where they are going to the front line, but they don't have the ammunition to make sure that COVID does not hit them. So this is ironical, and I think we need to get our focus and our priorities right and do whatever is necessary to make sure that resources are quickly allocated to these frontline people, so staff, so that they can help us in fighting the COVID.
When you talk about priorities, and I'm glad you mentioned that, because that was my next question. The BBI has left a very bad taste in Kenyans' mouth, and especially coming at a time when we are dealing with a pandemic. The number of deaths and infections continue to go up. Seemingly there is no money, and doctors have been told a number of times, even in counties, that there's no money to sort them out. But the major conversation among the leadership and the political class is still on the BBI. Do we need to take a break from this?
Well, I think what I can tell you is that if we were to win a war in terms of our public relations, I think we politicians are doing very badly at this point in time because more and more voices are questioning whether we have the finger on the pulse of the nation. You remember when we had a COVID conference at KICC, I did indicate that where are the fault lines in this fight against COVID? And it came out that politicians seem to be ranking very highly as one of the fault lines in the fight against COVID. Perhaps they may be the weakest link, because what has been happening is that politicians have moved around going about their business as if everything is normal. But as we speak today, we have also lost a member of parliament in the name, the MP for Matungu, where they were shuttling to try and get him to a hospital where there would be oxygen or ventilators, and they couldn't find it. And we are seeing so many other prominent people going through this exercise. But you see, the media may be highlighting the prominent personalities who may be getting into trouble with the COVID virus. But what about the ordinary Kenyan who is dying somewhere in the rural area, no diagnosis, and then people are exposed and the disease is spreading unabated? So this becomes a critical issue, and that's why I say that even as we pursue political issues and the political agenda, I think the question of our morality scale as politicians is ranking very low at this point in time.
Kenyans are calling for a break from the BBI. Do you think we need that, or is it a case of we'll be able to chew and walk?
Well, it is a dangerous thing to take anything for granted. Now, if people want to pursue the BBI, you will recall that on my part, when we were in Bomas a few days ago, I said it would be very important for the Kenyan people to try and close ranks so that we can narrow the differences around the BBI, build more consensus. I was not saying this because I do not believe in some of the contents of the BBI. I was saying this because I think it would be in the interest of every Kenyan citizen that as much as we have the crisis of the COVID on our hands, if we build consensus so that we can minimize what you call high-octane political activity around the issues of the BBI and possible debates that will ensue around it, it will be very good for the Kenyan people. Because if we can all win by having a non-contested referendum where we have brought all our issues together, we will spend less and the lives of our people will be safer.
But how possible is it to have a non-contested referendum, given how contentious this particular report has been in a country of about 50 million people? How possible is it, and what does a non-contested referendum look like from where you sit? You
know, you see what I've just seen from, listen to your news conference. You have said that there has been a postponement of the collection of signatures. Perhaps this is some kind of divine intervention which gives Kenyans room to quickly close ranks on the areas that were extremely contentious. I say so because once the final publication is done, that is the document that signatures must be appended to. Now, with this slight delay, if I may put it that way, that has been occasioned, then we could use that opportunity so that when the government printer is doing the final publication, the gaps will have been narrowed. And maybe the best measure here is that you will recall that in the referendum of 2010, or end of 2009, that is for the 2010 constitution, you remember the threshold was about 70% acceptance of the new constitution. So my wish is that we should, at the very worst, retain that 70% acceptance, but if we quickly work on the contentious issues, we can quickly have an acceptance of even maybe 80%.
We're running out of time. Let me just ask this, and perhaps keep your answer very short. A number of leaders have said there's a very slim window that amendments will be made in this particular proposal. You have been championing for this from the word go. So in the event proposals, amendments are not made in this proposal, what will be Musalia Mudavadi's stand?
I think we have had some dialogue on this particular issue, a dialogue chaired by none other than His Excellency the President, and other party leaders were there, including the Right Honorable Raila Odinga. And if I were just to simply say that my understanding of the session we had is that there is some general acknowledgement that some areas need to be rectified. And that was the understanding that came out of the meeting we had. I will not disclose any other details. And it will be a matter of good faith to make sure that what we did agree, what came out of that conversation, is maintained so that trust can be enhanced. Because the issues you are seeing around this thing is people feeling that there's a breach of trust in what we should do to get together. So I hope that the spirit of the session that we had shall be maintained going forward so that we can have unanimity or near unanimity on the issues of the BBI.
All right, you remain hopeful. I wish we could continue this conversation. A lot to canvas. Thank you very much for speaking to us. Musalia Mudavadi, ANC party leader, speaking on perhaps our way out on COVID-19. Building a consensus, he says, will help reduce the high-octane political activities in the country and, of course, help channel the energies in the fight against COVID-19. Thank you, sir, for joining us.